Miss Jillian. I'm an UNCW nursing student. Can you tell me your name and date of birth? Jamie Smith, January 1st, 1980. Thank you, Miss Smith. I'm here to give you your medications for the day. It's only going to take a few minutes. Is now a good time? Yeah, that's great. All right, wonderful. So I'm just going to wash my hands and shut the door, have privacy. Okay. So I've got my computer here. I've already done the first check of the medication outside of the room. Okay. So how are you feeling today, Miss Smith? You're feeling good? Okay, that's great. Do you have any concerns you wanted to talk about before we get started? No? All right, sounds good. Well, if you think of anything, feel free to interrupt me. So the medication that I'm giving you today is called Prozac. Have you heard of that before? You have, that's great. So just as a refresher, this is an antidepressant, so it's used to treat different things such as depression, ADHD, OCD, panic disorder, and some eating disorders. Your physician has diagnosed you with depression, so we think it's going to be a good fit with you today. So do you have any questions so far about that? How does it work? That's a great question. So it works by keeping serotonin available in your bloodstream. We call that preventing reuptake. So serotonin is a natural chemical in your body that it helps stabilize your mood. Some people call it like the happy chemical because it can increase the feeling of happiness. Yeah, that does sound great. So I do want to let you know that, like with all medications, there are a few side effects that you can experience. They could be sweating, itchiness, or diarrhea. You could also feel a little bit anxious or tired, and you could get a form of a headache. Those are just some more mild symptoms that we commonly see. We do want you to let us know if you do start experiencing any kind of suicidal thoughts. That is something we'd love for you to bring to our attention as soon as possible. There is also something called serotonin syndrome, where your body has too much serotonin in your bloodstream, even though you wouldn't think that's possible, but that can be a bad thing. So we're going to monitor your vitals to check for a fast heart rate, fluctuating blood pressure, and any kind of fever. We'll also be monitoring any sort of hallucinations, agitation, nausea, vomiting, and of course we'll also check to make sure that you're not having an allergic reaction during any of this, since you haven't taken this medication before. Lastly, we may get a blood draw just to get a complete blood count from you, just to make sure you aren't experiencing any kind of blood disorders during the use. So knowing all of that, do you have any questions for me now? So what if you get switched to a different medication? That is a great question. So the generic name for Prozac is fluoxetine, sorry. A lot of antidepressants in this class do start with flu, and I'm sure if you've had the flu before, you know you kind of feel down in the dumps, you're in bed all day. So this may be similar to how you feel before you take fluoxetine. So you take your fluoxetine to get rid of that. So this is one way to recognize different antidepressants and if it's similar to one that you're taking now. Does that help at all? Good, good. So Brad, at this point, do you feel comfortable taking this medication? You do? Okay, great. So I'm just gonna scan your armband, beep, and if you can just tell me your name and date of birth again. Jamie Smith, January 1st, 1980, great. All right, so I'm gonna check this again on my computer. I've got fluoxetine, 20 milligrams by mouth once today at 8 a.m. The expiration date is in 2023, so that's good. And do you have any allergies that you're aware of? No? Okay, so that's all good. I've scanned that in the system. So I'm gonna give this to you, and then you have some water as well. Can I get you anything else before I go, or do you have any more questions for me? No, that's it? All right, well, if you need anything, you have your call bell, and you can just let me know if you have any more questions. All right, thank you.